Good morning and welcome back. We are kicking it off with a great lecture this morning, Chiropractic, Neurology, Rehab, and some Home Workstations, Part 1 with Dr. Gideon Orbach, who has been with the Weiner Wellness Center. Doctor, how long have you been part of the Weiner Wellness Center?
I'm closing in on 14 years.
Wow, that's awesome. Congratulations. Well, we were just chatting in the background about how he hasn't been out of his treatment room because he's just loaded with patients. So, Doctor, I'm really excited to hear this lecture. Thank you for being here. I'm going to step back and let you take it away.
All right. Thanks for that, Tracy. First of all, good morning, everybody. My name is Gideon Orbach. I've been practicing chiropractic here at the Weiner Wellness Center. As we mentioned a moment ago, September is going to be 14 years here for me. And August of this year is going to be my 20-year anniversary since graduating chiropractic school. So I've been at it for a while, hardly a lifetime, but long enough to notice a few things and see what's going on. And if you're paying attention, learn some patterns and figure out some pretty neat tricks that really do work. So I'm enthusiastic about that. So what I do is I make adjustments to the spine, to the extremities. I do muscle work. I do low-tech rehab. I know that later on in the day, Dr. Phil is going to talk about high-tech rehab, but what I'm interested in is how to use and position and move your body as the apparatus. How do you exercise without equipment? I do a little bit of condition-specific rehab, and all of this is done so that people can feel more comfortable living in their bodies and establish better brain-body communication. So that's what I do here. And in all the pre-COVID years, all these workshops and all these lectures would be done live in front of an audience downstairs in our waiting room, and somebody would invariably have something smart to say, and I would try and reply with something a little bit smarter. And that's not gone away just because we're not here face-to-face and we're using the technology that I'm so thankful for both Tracy and for Phil for setting up to make this available and possible. Feel free to make liberal use of the chat box. And if you have questions, just type them on in. If you want to say hi, if you want to just acknowledge that you're here and listening, use the chat box. So anyhow, this workshop is geared towards a combination of a lot of the workshops that I've done in the past that we're making room for more speakers. So some of us had to consolidate. I used to break this workshop down into 3 different parts, and now we're going to do 2. So I hope it'll be as well organized publicly as it is in my mind. And the place where we always begin is we got to talk about health. What does it mean to be healthy? What does it mean to possess the quality of good health? Now, here's the point. When we were live, that people would raise their hands and I'd call on people and practice the gotcha technique of maybe asking people for their opinion, even if they didn't want to volunteer it. So once again, feel free to use the chat box and type in your idea of what it means to be healthy. But since I'm here and I have the mic all to myself, I'll just tell you mine. What it means to be healthy is having the ability to recognize, interact with, adapt to, and overcome your environment, both internally and externally. So your internal environment is your body chemistry. It's the way your brain tells your digestive tract to digest a little bit quicker or digest a little bit slower. It's the way your brain tells your heart at what kind of rate you should be pumping. This is our internal environment, all the neurochemistry that goes along, and that's involved with what happens with our organ health. Now, we can certainly influence our internal health, our internal environment, by taking appropriate nutritional supplements. I know there are a lot of very, very talented speakers and nutritionists coming forth over the week to present their ideas and to provide a little bit of nutritional supplement education. That's not where I live. I'm a little bit more geared towards the external environment, where we talk about things like how you interface with the people around you. How do you maintain your position in space in a crowd? How do you have the ability to turn and look over your shoulder or check your mirrors before you merge in traffic? Your external environment, what's going on in the universe around you. So to me, if you really want to be good at managing your external environment and managing your position within it and your position in space, what we have to do is we have to think of our bodies as being a giant antenna. I speak often about improving brain-body communication. But what does that really mean? Your body and your brain, every single cell of your body is in constant communication with the brain, transmitting and receiving messages from the environment, both internal and external. So if we think about our external environment as being all the stimulus around us, what we want to do is we want to position our bodies to be as efficient and effective as possible at receiving information from the environment, such as, is the pressure building up in the atmosphere and we're expecting rain, so should we bring an umbrella? That's our external environment giving out messages, our bodies, our giant antenna receiving the message, our brain telling our body how to behave accordingly. So it all comes down to, in my practice, the ability to have good posture and the ability to breathe. So what I want to do here is exercise number 1, and we're going to talk about good posture. So the first thing I want to have everybody do is, if you're in a place where you're capable of standing up, go ahead and stand. If you're in a super comfortable chair, or you don't want to stand, or you don't want to indulge me, or you can't stand up for whatever personal reason, you can certainly do this sitting, but we're going to talk about the standing experience. I'm thinking about right here in the middle of my tie at this button, I have my what's called my xiphoid process. It's a little piece of very tender cartilage at the bottom of the sternum and the top of the abdomen. So I have my hands right here to mark where my xiphoid process is, and here is my belt buckle. So I have this region of my body from my belt buckle to my xiphoid process. And I want to think about making myself as tall and as long as I possibly can. And I'm going to stand up as straight as I can, stretching this region. And what we're going to do is we're going to think about almost bending it over backwards. We're stretching it that tall. Then what we're going to do is we're going to take our shoulder blades, the wing bones in the back, and we're going to think about touching our belts with those bottom of those shoulder blades, which is pretty much physically impossible, but it's a good visual to get us where we want to go. So I have my shoulders backwards, down. I'm sinking my shoulders. I have my length right here in my abdomen. I'm tall. And now I'm just going to stand here in a relaxed position. And it's a very easy and comfortable position to stand in. Why? Because my muscles, my skeleton, my connective tissue are all working together as one single unit, doing their role to support myself, rather than if I start to slouch or slump, now all of a sudden I'm putting more load on different specific anatomical parts, creating asymmetrical work, creating unnecessary and uneven torquing or pulling. So I'm standing in my comfortable posture. And the next thing I'm going to do is I'm going to think about a little string coming down from the ceiling, attaching right here to the top of my headphones that are just going to pull me up and lift my head up towards the ceiling. So here I am standing straight and tall in good anatomically appropriate posture. So because I'm participating with the technology and not live in front of you, I'm hoping that everybody who's involved in this workshop is doing this right along with me. And I can't see you, but I feel that collective sigh of, this is comfortable. I can remain like this. And if you have questions or require more specifics, please don't hesitate to type them into the chat box. And now that we're in our ideal posture, what we're going to do is we're going to focus on the way we breathe. What I want everybody to do, we're maintaining that sunken shoulder position. So we're not going to breathe by inhaling and lifting our shoulders up to our ears, so much as we're going to take a deep breath in through our noses. And what we're going to feel is our torsos are going to expand like so, rather than this way. So you're going to feel your abdomen and even your chest fill with air as you breathe in. Big deep breath in through your nose. And we're going to hold this for a second or two or three. And now we're going to blow out through our mouths in slow but forceful manner. Again, big deep breath in through your nose. And drink in that delicious oxygen. We're going to hold it. 1,001, 1,002, 1,003, and blow out through your mouths. Okay, so we're not going to break our posture just yet, but we're just going to hold this position for a moment or two without focusing on our deep breathing. But we're just going to be long in our torso. Our shoulders are sunk down and back. Our head is upright, being suspended from the ceiling with that little thread holding it up. And we're going to go as long as we can in this area, standing or sitting comfortably. Okay, now, the next move that we want to make is we want to take up as much space as possible and start to feel powerful. So what we're going to do is we're going to spread our legs wider than shoulder width apart. And we're going to bring our arms up over our head. And we're just going to take up this space. So we're essentially signaling like the touchdown is good, the extra point is good, the Steelers win again. And we're making ourselves big. And we're just going to hold this position for a few seconds. And what we're going to do now that we're established with that long in the torso, sunken down shoulder position, head upright, feet wider than shoulder width, arms taking up space. Let's take another big deep breath. In through your nose. Hold it. And blow out through your mouths. Let's do one more big deep breath in our big position. Big deep breath in through your nose. And we're going to hold 1,001, 1,002, and out through your mouths. How many of you feel more alert now? How many of you feel a little bit more energetic? How many of you feel a little bit more powerful or a little bit more enthused? What we're doing here with this, it's called a power posture. When we're making ourselves big and claiming more physical space in the environment than what we're initially allocated for, we're turning on parts of our brain that are going to start to produce more endorphins. So this is a very quick illustration of what you can do with good posture, and we're certainly going to come back to this power position. Now I want to illustrate the exact opposite and explain why, or demonstrate why this is so important. Let's break our posture. Let's go back to a position. Let's imagine that we're sitting in the front of our computer and we're typing, or let's imagine that we're driving and we're leaning into the steering wheel. So now all of a sudden our heads are not supported by that string coming down from the ceiling, but rather we're bringing everything too far forward and breaking our routine. So when you are in this position, even if your abdomen is long, even if your shoulders are back, but your head is still forward, now take a big deep breath in through your nose and out through your mouth. Again, in through your nose. Hold it. Hold it again and blow out through your mouth. Now, I don't like to teach bad habits. I don't like to encourage people to do things the wrong way at all. But I think it's important that we can all emphasize and appreciate how much bigger a deep breath we're basically capable of taking once we are in our big upright posture where we're long in the torso, shoulders are sunk, head is upright, exactly as how the military would teach, versus this position. No questions, comments, moral outrages?
I have a question.
Yes, question from the...
Why do you breathe in through your nose?
All right, so the question from Phil, who is earning my eternal gratitude for the way he's manipulating the technology so we're able to do this, is why do you breathe in through your nose? The simplest reason is because we have these tiny little hair cells inside of our nose that act as filters. And to a certain extent, they're going to be able to file out the impurities as the oxygen comes in. So we'll be able to take a cleaner deep breath when we breathe in through your nose. There's some neurologists who are doing further research into this, and that what they're suggesting is that by breathing in through your nose, you are activating your parasympathetic nervous system, or dialing down your sympathetic nervous system. When we talk about all the things that the human body is capable of doing, some of which are voluntary, some which are non-voluntary. And the non-voluntary stuff that we do, we're going to call part of the autonomic nervous system. And the autonomic nervous system can be subdivided into two categories: sympathetic and parasympathetic. Parasympathetic is your relaxed state. It's you're going to slow down your digestion, and you're going to have better heart rate, and you're going to have more blood circulating throughout your entire body in a comfortable, relaxed pace. Your body is going to be calm. The sympathetic nervous system, in contrast, is your fight or flight. That's where survival is the matter at hand. What are we going to do to live to see another day? And our bodies are just wound up, and blood is shunted off from non-vital function. And then we start to see more blood going to the heart, more blood going to the brain. We're fighting for survival. Neither is 100% good. Neither is 100% bad. These two aspects of the parasympathetic nervous system are both completely necessary. They work on a push-pull continuum. One goes up, one goes down. Our species would not have lasted this long without both. So we can't say that we want to always be calm and we want to turn off our sympathetic nervous system. But it seems to me that there's been pretty good research lately to indicate that nasal inhale helps to drive the parasympathetics and inhibit the sympathetics. So once again, by the way, shameless plug for the Pro Reds. Not only delicious, but when mixed with water, they soothe your throat when you talk too much, which I happen to be doing right now. So once again, we're filtering and cleaning our air in through our nose. 2, we're activating the parts of the nervous system that will help us to calm down rather than to make us a little more hyper. Okay, so once again, what I want to do is take another review of standing in or sitting in our ideal posture, implement the power position component, and then I want to move on to talk about ergonomics and workspace stations. So we're going to spread our feet just a little bit wider than shoulder width apart. We're going to go real long between our belt buckle and our xiphoid process, the bottom of our chest, the top of our abdomen. I'm tall in here. I'm taking my shoulders and I'm just throwing them back. So my shoulder blades and the wing bones in my back are as close to my belt buckle or my belt as I can possibly get them. My head is being supported and suspended from a twine coming from the ceiling. And I'm going to breathe in, deep breath in through my nose, filtering my air, activating the calming senses of my brain. And I'm going to hold for 1,001, 1,002, 1,003, and I'm going to blow out through my mouth. Again, in through my nose. My chest cavity is expanding as I drink in that delicious oxygen. I'm holding some more. I'm going to blow out through my mouth. This time, I'm going to raise my arms up overhead. I'm going to make myself more powerful and larger than I really am. And I'm going to do the same thing. Big, deep breath in through my nose. I'm going to hold it, 1,001, 1,002, and blow out through your mouth. And please note, as I'm standing here in my power position, my shoulders are still sunk down. I'm not reaching or lurching or lunging for the ceiling. I'm still in that same position. I just pick my arms up. One more big deep breath. And I'm holding some more. And I'm going to blow out through my mouth. And one last time to illustrate the significance, We're going to bring our head forward into this. Do not do this, but I want you to see for yourself and have an object lesson. And I'm going to breathe in through my nose. And I'm going to hold it. And I'm going to blow out through my mouth. And I could only get a fraction of the delicious oxygen in as I could when I was standing up in good posture and breathing from my nose and my diaphragm and with my shoulders back. Now, one of probably the most common condition that I treat here at the Wellness Center is what's called a hiatal hernia. You have a tube in the back of it, starts in the back of your mouth. It travels down through your torso, passing by the section where the heart and the lungs live. It pierces through the diaphragm muscle in a hole called the hiatus. Below that hiatus of the diaphragm, there's a small, very densely thick ring-like muscle called the lower esophageal sphincter. It behaves as a one-way valve, allowing food, drink, pills to pass through that sphincter muscle. And then below that sphincter muscle, the tube changes names and it becomes the stomach. So the tube is very narrow and flexible, and then it widens out into a big bag full of acid called the stomach. The stomach's role is that it's vibrating and it's churning. And when you put food, drink, pills, what have you into your mouth and they fall into the stomach will bathe those substances with acid, making those substances smaller to tiny little sub-bite-sized chunks to be able to enter the intestinal tract, the continuation of the tube, to absorb the nutrients. So the stomach has the ability, because it's moving, the stomach has the ability to drift upwards. And if it drifts upwards high enough, then it gets caught in that lower esophageal sphincter muscle. The valve becomes disabled. And now what happens is that stomach acid can wash its way up into the esophagus, along with the small food chunks, the small bites, and they reflux up into the esophagus, which is a flexible tube once again, and it creates a burning sensation. Some people say that it feels so severe it's almost like a heart attack, and they go to the emergency room with burning in their chest, burning, searing pain. The good news is it's not a heart attack, and they're put through a battery of tests at the ER to determine what the cardiac enzymes might be like. The bad news, nobody identifies what it is, and the patient is left wondering what's going on with me. That refluxing food and acid can wash all the way up further, interfere with the vocal cords, and people will complain of having a raspy or a fatigued voice. It can wash up further into the mouth, and they'll have a metallic or an acidic taste. Because the esophagus is a flexible tube and it's being pushed upon by the stomach, instead of compressing this way, what happens is we're pushing up from the bottom and the esophagus will bend or it'll kink. And that's going to create a spot where it's very difficult for food, drink, pills, what have you, to pass around the bend down into the stomach. So we have this disabled valve. The stomach is pushed up into it, causing physical matter, including acid, to wash up. The stomach may have pushed up high enough that not only has it disabled the one-way valve that we've been talking about, but it might have pushed all the way up into the diaphragm muscle, into the hiatus of the diaphragm, and now it's called what's called as a hiatal hernia. Easily one of the three most common conditions that I treat, probably the most common. So what happens? Why would the stomach pierce through the hiatus of the diaphragm, or at least penetrate through the lower esophageal sphincter muscle? We have to have, the stomach is moving, and we have to have a competition for space. Something has to physically push the stomach up. Well, one of the things that can cause this is bad posture. So when you're sitting at your desk or driving or walking through space or wherever you happen to be, and you're in this kind of a compressed position, now we're creating an environment where the stomach is going to be pushed directly into that lower esophageal sphincter muscle, increasing the probability that it could be caught. So what's the treatment for this? Well, we do a series of chiropractic adjustments where essentially we're going to push on the stomach and get it to sink down out of whatever structure it's caught in. And we're going to do an adjustment to the rib cage, and we're going to get the torso to lift up. So what are we doing? We're essentially using physical force to make those patients tall in the abdomen, long in the torso, and throw their shoulders back. Not a day goes by, not a single day goes by where I don't make that series of adjustments on somebody. So if you have been diagnosed with gastroesophageal reflux disease, GERD, or if you've been diagnosed with a hiatal hernia, or if you have some of the symptoms that I'm describing and you just don't know what's going on with you and you'd like to have a conversation about it or be evaluated, both myself and Dr. Phil treat these conditions every day. All right, so let's move on to ergonomics. Ergonomics is the study of efficiency in the workplace, plain and simple. Well, the workplace has changed. So many more and more of us are working from home, and we've become forced to create our own working environment and to create our own workstations and to figure out how to be as efficient and as effective with the tools that we have at our disposal rather than the tools that we once had at the office. So depending on the way you sit, you're going to increase the pressure on your spinal discs by as little as 40 and as much as 90%. And when you consider the economy of back pain, back pain, what an industry that is, the economy of back pain. That's a real term. The fact that it's such a common thing and the fact that people have so prevalent back pain in our country that there's actually a study on the economy of back pain, that should tell you so much right there. The loss of work, the loss of productivity, the number of surgeries, many of which are unnecessary, certainly not all. The long, painful rehab process, the treatments. And so much of that is, I don't like to say the term self-inflicted because that would imply that we're blaming victims. I don't like that at all. But what we're having is people who just haven't been coached as to how to sit, how to stand, how to move their bodies through space, and not only causing their own hiatal hernias, but also causing so much compression on their discs, so much back, especially lower back and neck injury by sitting in aberrant posture, in a bad chair, in a position that's just simply uncomfortable for their personal physiology and their personal mechanics. And now here we are having to design our own workstations, most of us without really any idea of how it's supposed to work and what it's supposed to look like, and how we can maximize our own efficiency at our workplace now that our workplace is in our homes. So anyhow, a little bit of conversation with some professional colleagues. I have a great group of chiropractors all around the country that I communicate with. We share insider stock tips. We talk about patients together. We lean on each other for, like, if I'm getting nowhere with somebody, I have a great group who hey, this person has X, Y, Z. I'm seeing a lot of trees and missing the forest. What do you guys make of this? And of course, at this point, as I told you, 14 years at the Weiner Wellness Center, 20 years in the profession. Somehow, when I wasn't paying attention, I became one of the people that the others all lean on, and that's kind of cool for me. But this great group of people who are just smart, really, really smart doctors. So one of the things we talked about was, what would you instruct patients? What would you tell your patients about how to build a home workstation? So between the group, we came up with, what was it? I think we're up to 15 good tips of 15 ways to make your workstation better, to become more productive at home, more productive in your workplace. So I'm just going to go through this list and we're going to talk about each one individually. And the first of which is I would encourage everybody to get a sit/stand desk. Now you can't really see this pretty well with the camera placement, but I'm standing and there's a table right in front of me. And I have, some people pass out flyers and handouts, and some people have PowerPoint presentations. I'm right out of the Dewey Decimal System, and I have these index cards with my key points on them that I'm just, I'm talking to talk. I'm talking about the things that I do every day. I feel comfortable calling this more of a conversation, not a lecture. And I have my bullet points sitting here at this table that's a little higher than my belt buckle, so it's out of the picture of the camera, but it's the perfect height that I can just kind of look down, glance down. Oh, here I am in my notes, and I have other speakers' notes are spread out all over the table. And all I can think about looking at this is this would be a great way to work. The table is the perfect height, and you can probably see that as I'm talking, I shuffle a lot. That I don't stand still at attention and rigid the whole time. I'm keeping my body active and involved in what I'm doing. I'm sure if I were writing something or if I were typing, I would be still. But as I sit here and talk and leaf through my notes or glance down at my notes, you can see my body is just moving. And there's a reason for that. Neurologically, I'm just activating. I'm getting my body to move. And it's talking to my brain, and it's telling me that I'm in a new space. I'm adapting, and I'm moving on to a different space, and I'm shuffling. And I never get stiff or sore. And I don't let my knees lock, and my ankles don't lock. And I don't get stiff by doing that. So ideally, your home workstation is going to be at a sit-stand desk. You're going to be standing, and you're going to just be creating your own little dance at your place, just rocking back and forth at your heel toe a little bit, sliding your hips from side to side, keeping your body active, pumping, using your muscles to help pump your circulation along. All right, so we want to be at a sit-stand desk. Let's say you don't have that. The next thing we would want to do is, at the very least, have a good ergonomic chair. If you work for a company, they might have a budget to buy you a really good chair to set up in your workstation at home. You just don't know what you can get until you ask for it. So go ahead and ask HR to get you a good ergonomic chair. What's the worst thing that can happen? The next thing we want to talk about is 90-90-90-90. So if you are sitting, we want to think about, imagine for a second, this is my foot. I want to have a 90-degree angle between my foot and my shin, right? My next 90-degree angle is going to be between my shin bone, the tibia, and the femur bone, my knee. So my ankles are bent to 90 degrees. My knees are going to be bent to 90 degrees. My torso is going to be 90 degrees to my thighs. And my elbows are going to be 90 degrees right in here at this crease, right there. And my wrists are going to be 90 degrees to the keyboard, tucked in close to my body. So I'm putting myself in a really good biomechanical position, following the 90 degree principle. That might mean if you're sitting and you're just like, my chair doesn't cut it. I can't. My legs aren't long enough. Don't have enough space underneath my desk. Whatever it might be. Well, there's no rule that says you can't raise or lower the height of your chair to accommodate to get yourself to 90. There's no rule that says you can't adjust the height of your computer monitor to get yourself to 90s. We want to talk about personalizing your workspace. Move some art that you like. Move your favorite poster into your workspace area. If you have a collection of little trinkets, if you have a favorite 50-cent piece or coins from a foreign country, or just something that you're connected to that you think about as being a decoration, put it in your workspace. Turn it into an office that you feel comfortable being in, that represents you. Might want to hang if you live with other people, you might want to hang a do not disturb sign on the outside of your door. This idea actually was presented to me by a patient who was very much distracted by their family. I mean, in a good way, but nonetheless, this is my work day. I might as well be at the office. I'm not available any more so than I would be at the office. So please be respectful. I have the door closed. I'm being productive. I have a do not disturb sign on the door. Knock before entering. Text me or call me if you need something. I want the people in my environment that I share space with to recognize that I'm at work and to give me the space as if I were away at the office. But I don't want to lose sight that I'm still at home. So the do not disturb sign. The next thing was the light source. We want to make sure that our workspaces are well lit, but we don't want to have a bright light shining in our eyes, and that bright light might be the sun. So where is my desk relative to the window, relative to the sunrise in the east, sunset in the west? Is there going to be a point in the day where I'm sitting at my desk, or better yet, standing at my desk, and all of a sudden it's going to get so bright that I just can't be productive? Is my light source shining at my computer monitor? Is the glare coming off of my monitor so uncomfortable that I can't be productive there? That's something to consider. All right, I want to reinforce how important these things are. So before we move on with the workplace tips, let's reinforce ourselves being really super long in the torso. We're tall from the belt buckle to the xiphoid process, the bottom of the sternum, the breastbone. Our shoulders are back and down. Our head is suspended from the string coming from the ceiling. And let's take a couple of big deep breaths in through your nose. Feel yourself expanding outwards like a big barrel, not up and down. So I'm breathing in. Hold 1,001, 1,002, and blow out through your mouths. Again, big deep breath in through your nose. We're holding 1,001, 1,002, and blow out through your mouths. One more time. Big deep breath in through your nose. Torso is expanding. Everything's bigger. Hold it and blow out through your mouths. One last time, but this time we're going to do it with our arms up over our heads. We're taking up more space than we're allowed to take up. We're telling our brains how powerful we are, borderline invincible. Big deep breath in through your nose. Hold it, 1,001, 1,002, and blow out through your mouths. Okay. Let me ask this question. Does anybody out there feel lightheaded from taking those couple of 2 or 3, even more deep breaths that we've been taking? Once again, once upon a time, these workshops were all done live, and inevitably somebody would raise their hand and say, yes, me, I feel lightheaded. Well, that's your body adapting to a temperature change. As you breathe deeper and you get more oxygen in and your body becomes more efficient, your internal temperature changes, and you feel yourself maybe getting lightheaded a little bit to adapt. Not to worry, it's perfectly normal. Let's say, for the sake of the conversation, that you can take 5 deep breaths before you start to feel lightheaded. I'm curious how many times you have to do the drill before your body adapts to that and it becomes 6 deep breaths or 16 deep breaths or however many it may be. And in a way, we're going to use that as an objective measuring stick to see how is your body becoming more efficient along the way. And I promise you this, everybody has a threshold. At some point, even a great yoga master can breathe deep enough for long enough that they become lightheaded. It's not you, it's all of us. The other question I used to ask when people were live and in person, when you take that deep breath, do you have a pinching somewhere in your upper back near your shoulder blades, creating a sense of discomfort that may even, in fact, wrap around to the front? If so, it's very possible that it's proof positive that you could benefit enormously from a chiropractic adjustment in order to mobilize your ribs. All right, anyway, I really like to take these timeouts for the shameless plugs and tell you about the treatments that I offer here at the Wellness Center and point out some very common things that people come in with. And over the years, I've become pretty good at helping people with. But let's get back to the matter at hand. So we talked about our light source, and we want to set up in such a way that we're not staring into sunlight or a bright lamp, and we don't want to have that same light source bouncing off of our monitor in such a way that it's blinding to us. And then speaking about the monitor, we want to make sure that we have it at eye level. So once again, we're going to adapt our bodies to that 90-90-90 principle. And once we're there, where is our computer monitor? Do we have to raise it to get to eye level? Do we have to bring it down? Do we have to prop it up our seat a little bit higher or lower? So we're going to have a good match between computer monitor, eye level, good upright posture, long in the torso, shoulder blades thrown back, 90-degree angles at our ankles, knees, elbows, and wrists. All right, so let's say you don't have a sit-stand desk. Let's say that you're working at a flat table. There's nothing wrong with it, but we still want to make it as comfortable as possible for you. And you've asked your HR company to buy you a good ergonomic chair, and they said no, we can't do that for you. Or maybe you own the company. Maybe you're a one-man gang or a one-woman gang working from home at a startup. Maybe you're at home developing an app that you can't afford to buy your own ergonomic chair, but someday soon you're going to produce your app and 40 million people around the world are going to buy it for $1 a piece. Pretty good place to be. But in the meantime, you're on a tight budget. There's nothing wrong with taking a couple pillows and putting them on your chair, maybe one to sit on, maybe one in the small of your lower back here to be more supportive. You can use your pillows to turn almost any chair into a fairly comfortable ergonomic chair that you can prop yourself up in, long in the torso, shoulder blades back, head is up, and I have pillows reinforcing that position for me, making it even easier to be in that position. You want to make sure that you have a dedicated workspace. Even if you live in a one-bedroom apartment, I live in a one-bedroom apartment. Even if that's the case, I have an area in my apartment where this is where I go to do my studying, my paperwork, my administrative stuff, to write my letters, to compose my thoughts. If I'm working at home, I got a very specific space in a pretty small apartment to make it all happen. And that's my dedicated workspace. Now, since I live alone, I don't have to have a do not disturb sign. But I don't do important work while sitting on my couch. I don't do it while I'm lying in bed. I don't do it while I'm watching TV, glancing up and glancing down. 1 minute I got my eye on the ball game. 1 minute I got my eye on some work that, look, this represents me. It has to be done well. So I have my dedicated workspace, and I'm free of distractions, and I'm maximally comfortable when I'm doing it. Speak at every meeting. If your meetings are at Zoom or some other online platform, every single time you interact with a group of people, make sure they know that you were there. Even if it's as little as just saying good morning or good evening or wish everybody good health or something that might be not really relevant to the matter at hand being discussed, but very much relevant to everybody in the meeting knowing that you were there and present because you participated and asserted yourself even for a moment in time. The dress code. Even if you're working at home, even if you live alone and you're working at home, dress like you mean business. At the very beginning of the work at home, shelter in place, stay at home unless you absolutely have to get out, I had a lot of really good laughs. I mean, we worked the whole time. I came to work in March, April, May of 2020 when we didn't really know what was going on, what to expect, who's in charge, what's essential, what's not. If you work and you bring home an income, your work is essential as far as I'm concerned. But some sort of administrative body decided that some work was essential and some wasn't. We were physically present at the office. And I had a good joke going back and forth constantly with friends in other professions who were like, oh, which tie did you wear today, Orbach? While they were at home and this one was in a wife beater and that one worked in her pajamas all day. And this one was thrilled because she didn't have to worry about taking the time to do her hair and her makeup. And that one was well, I wore the same jeans every day for the last 2 weeks. Who's going to know? It was funny at first. It's still funny. But just as we want to stand here in these big power positions, and by the way, on Friday morning, here's another shameless plug. On Friday morning, I'm going to be speaking again. I'm going to be talking instead about workstations and ergonomics. I'm going to be talking a lot more about neurology and the subconscious mind and the conscious mind and how we use non-voluntary activity to suppress pain and all that kind of good stuff that just excites me to no end. Hopefully it'll excite you to no end and be there. But just as we talk about that, we have to have a little bit of pride and a little bit of, you know what, I represent myself. This represents me. And even if I'm working out of my spare bedroom, I'm proud of who I am and what I do. And I'm dressing like I'm going to work. All right. Next hot item on the list is the multi-plug outlet. We don't want to trip over our power cords. If you have, your computer and all of your electronic devices plugged in the same place or the same places, why have 6 different outlets going at once when you can trip over every single cord, bundle them together, and have a multi-plug outlet that you're not going to trip over the cord. Have a routine. If you have a group of friends who you don't necessarily work with, but they're all at work at the same time as you, working from their computers in their homes or wherever they might be, why don't you arrange to meet at specific times of the day and just stop what you're doing and everybody get a glass of Pro Reds, drink it together, swap a few texts, tell each other jokes, exercise your human being muscles, enjoy a little bit of downtime at very specifically predefined intervals. Because we're standing or sitting in such good posture with our shoulders thrown back and our heads are up, this shouldn't really be thought of as an exercise. This should be thought of as normal posture. So one of the really good suggestions our group came up with is come up with exercise, have exercise breaks throughout the day. If you want to go to the gym or if you have exercise at home and you want to spend hours and hours working out and exercising, go for it. I will not be the one to stop you or try and talk you out of it. But let's be realistic about time management. If you've been to the zoo and you stop to watch the monkeys play, they are very, very sedentary creatures. And then all of a sudden something happens, like somebody flips a switch and the monkeys start to, they swing from the vines and they climb the trees and they wrestle with each other and they run sprints from one corner of the habitat to the other. And then they stop and they go back into sedentary mode. And they have these moments of the day, these periods of time. They're short bursts, but they're extremely active and they're extremely physical. I just very quick time out. I'm looking at the side of the computer monitor, and somebody just said hi, watching from the UK. So thank you thank you. Thank you for your kind attention. Thank you for reaching out. Thank you for being here. Thank you for participating. I hope you're healthy and safe. So our monkeys just calmed down. And if we think about that in human terms, why not have 5 or even 10 very, very short exercise breaks during the day? Why not have a few little breaks in our workday where I know I'm going to take 5 minutes here to go and do some breaking for what I'm doing. I'm going to go do something physical, and then I'm going to come back to work multiple times. Why not have a workout routine in your home where you might be working out 20 minutes maximum, 2, even 3 times a day? Follow the monkey model. So my guy Sean in Florida said we should be working more like monkeys. And he had the suggestion, this great suggestion, advocating for our rebounder. A rebounder is a mini trampoline. It's not a very expensive piece of equipment, and it'll fit into most people's floor plans. And he was talking about a patient who couldn't get out and run anymore because her knees were in such bad shape. And she started just bouncing on her mini trampoline and came back to report that it was more fun and it was a more intense cardiovascular exercise routine than her long distance running. And she enjoyed doing it, and she set her mini trampoline, her rebounder up in the corner of her workroom, and she would just take breaks to bounce and trampoline throughout the day, which was an excellent idea, and I'm here sharing the wealth. All right, so anyhow, everybody, not just our new friend in the UK, but thank you all for your kind attention, for taking the time to listen to what I have to say. I go to continuing ed classes every year, and the criteria that I use to determine which classes I'm going to go to, I'm going to participate in, is one of my favorite mentors speaking, and if so, are they a reasonable travel distance away? 2, is there, if I'm going to sit through this class on all weekend long, am I going to get something out of it that I can use in the clinic to be just a little bit better at what I do on Monday morning? And that's the criteria by which I present my workshops here at the Wellness Center during Wellness Week. And I hope that I come across in a way that these are actionable steps. They're things that people can be doing, and it's Tuesday morning. And I hope each and every single one of you who's indulged me this long is able to do one more thing to better improve your health by Wednesday morning, that's tomorrow, to be able to better recognize, interact with, adapt to, and overcome your environment, both internally and externally. So with that in mind, I'm going to have to turn the microphone over, and thank you all once again. And a special thank you to both Tracy and to Phil, who make the technology possible.
Yeah, absolutely. Thank you, Dr. Orbach. That was fabulous. All right, guys, stay tuned because our next lecture is coming up at 10 a.m., which is me. I'm going to be talking about SPM, Specialized Pro-Resolving Mediators, and how to help you overcome lots of inflammatory issues, chronic issues, utilizing these unique new discoveries. So stay tuned. We'll see you at 10.